Hamadakapi, people of Standing Rock, on March 13th, I declared a state of emergency. The coronavirus is alive and well around us. We must take action now.
You can take action by staying at home, sanitizing your surfaces, washing your hands, and shopping local. Try to avoid traveling off the res and close contact with others.
And with that, our tribal employees, our incident command, tribal health, and emergency management team has been working day in, day out. So please, let's all work together and be understanding in this time of emergency. How Madaki Wase.
Ampeti Washte, Chunte Washte Machapi. Margaret Gates, Tribal Health Director for the Standing Rock Sioux Tribe. Also right now, the Incident Commander for the Standing Rock Sioux Tribe, COVID-19.
Hamadakiapi, Maushlavia, Imachiapi, Petra Harmon Wanhak, as Margaret shared, I'm the Director for Nutrition for the Elderly.
On March 13th, the Standing Rock Sioux Tribe activated the emergency management and put the ICS in place. Under that, the tribe put the responsibility onto us. There's several things that have been in place with the tribe throughout this, working with Indian Health Service and continuing to inform the people. And I'm proud to say that we have been working diligently. We have a very knowledgeable team, but what makes this unique is that we're fighting against something that we cannot see. And that for us makes this a very grave concern for our people. And like we've stated to our leadership and the tribal council and to the people that we have talked to on Standing Rock, is we are concerned, and that becomes our goal, is our elderly population. And that within our tribe systems, within our programs that we have, today the tribe implemented a partial shutdown within the Standing Rock Sioux Tribe to essential staff only. What that means is the tribe is not completely shutting down. We do work for the people of the Standing Rock Sioux Tribe, and we have to ensure that those services are continuing to be met. We will be getting that information to the districts, to the people, as soon as possible beginning today, so that you know what those services are. So Monday morning, you're still going to be able to call those numbers, and we will tell you what services are still here. Under the ICS system, like I said, we are working diligently. We have the safety officer that's there, Suzette Mellon, with the ambulance program and keeping that update. Today they presented their safety plan. They've spoken with the state. There's a lot of things going on, and with that, at this time, I would like to turn it over to Petra Wanhak Carmen, who has been with us from the beginning, and she also has many hats with the tribe, and she works with the nutrition for the elderly and services for the elderly. And I'm very proud to have Petra on the team because she does provide that medical standpoint as well. And I've relied on her as well as safety and everybody on the team to be able to get this message to the tribe that we are informing our leadership. We are informing everybody along the lines, and now the public, to be able to let them know exactly what this is and the concerns with it. And with that, I'll turn it over to Petra.
My major concern as the director is that our program only serves 430 elders, and according to the census, there are 1,600 elders on the Standing Rock Indian Reservation. And I'm asking you to report to your district chair or anyone on the district committee of any elders who you know 60 years and older. Please share their contact information and their name. And I also ask that you include those that are not tribal members, so that we can take care of them also. We ask that you practice social distancing, and what that means is that you're practicing not going into groups of people more than 10 or even less than that. If you can stay home, stay home. It's still okay to go outside and get fresh air. Washing your hands, make sure that you wash your hands. And also, one of my concerns is that we have a lot of elders who take care of their grandchildren, and they need your help at this time. Putting a plan in place that helps to separate the elders and have their own space, that they're safe. The plan that we have put in place is actually a plan that is meant to flatten the curve, and what that means is that we slow down that infection rate of this virus. So it's crazy because we're actually really in a pandemic. And what that means is that this is a virus that humans, that our people and the rest of the people of the world have not seen before or have never been infected before, and it comes from an animal. I just want the people to know that this is really serious, and as Lakota, Dakota people, we know our relationship with Unchimaka. And we know that we're given the responsibility to take care of creation, take care of our relatives. And the reason that this is happening is because as humans, we're not doing that. And as a result, Mother Earth does things to protect herself. And one of the ways that she does it is a virus. And viruses are germs. So germs are bacteria and viruses that cause us to have a cold and cause us to have the flu. And so we know that in order to stop the spread of germs, we have to wash our hands, cover our mouth when we cough, and that means coughing into your elbow instead of using your hands, and making sure that you're cleaning the surfaces and not touching. But we need you to do that more so, and we need you to practice what they call social distancing. The way that the virus works is that the closer that we are to one another, the speed of that virus moving from one person to another actually picks up speed. And so by closing down the schools, going to a partial shutdown for the tribe, what we're hoping to do is that we can slow down the rate that virus is going to jump from one person to another. And so if I'm asking you to stay home, you can still go outside and get fresh air, go for walks, and just don't hang out with each other. And I know that's really hard for us as Lakota people because we love our families and we love our elders, and we need you to take those extra precautions for our elders, and then we also need you to remember the people who have health conditions. What's different about this virus, and when a virus hits the human population like this, when it crosses from an animal to humans, that's what they call a pandemic, because our body doesn't have the protection to fight that virus. But what's different about this one is that if the virus was to jump from me to Margaret, and how it works for viruses is that it's usually infectious by the time Margaret would get sick and be coughing and would feel really bad and have a fever. That's the time that she would be most contagious, spreading the virus. What's different about this virus is that when somebody catches the virus and they're barely even starting to get sick, that virus is already spreading to other people, and they call that viral shedding. And this particular virus, what they call the coronavirus COVID-19, is that it's shedding 1,000 times more than the last virus that caused the last pandemic, which was SARS.
If there are people that are getting sick with the fevers and chills and the cough and the shortness of breath, that you isolate yourself in a room in your house. But what the urgency is here that we have been trying to spread is for us as tribal health director, is that this is a hot spot for us here on Standing Rock, because our reservation line goes to that line and to that border, and that becomes Martin County. And not only that, we do have a lot of that people aren't listening. They haven't been listening. We shouldn't be going out of our homes, out of the reservations. Keep washing your hands. We keep reiterating that because we are trying to slow that curve, and that's the urgency of this. But to not panic, because when and that happens, that there is a case on Sioux County or Corson County, we have been giving out this information as to what to do. And like Petra explained, a lot of the symptoms might not be there. Some of them may, some of them may not. So it is important that you call the numbers, the state of South Dakota, North Dakota State Health Department, South Dakota State Health Department. Again, those links are put on the Standing Rock Sioux Tribe webpage, We ask you to use that. We ask you to share this information with your family. And like Petra said, it is important to continue to practice those safety measures that we've been putting out for the past 4 to 5 weeks. And I guess with that, I don't have anything more to say, but I just ask you, the people of the Standing Rock Sioux Tribe, to stay safe, read the information, take care of one another, and to not spread panic or rumors, but to call and get your information from the right sources. You can call the service unit, you can call the ER if you have questions, if you have a concern. So please call, if you need to call those numbers, call them and they will advise you what to do. If you get to that point where you are sick and you do have respiratory problems, call the ambulance service, call the police station, call 911 and follow that procedure.